it's Guy DiMartino. I'm an Northwest Indiana medical malpractice lawyer, and today I'd like to talk a little bit about surgical malpractice for neck surgery or back surgery. So, one of the issues with a surgical malpractice case, whether it be your neck or your back, has to do with the fact that you had some underlying medical condition which required the need for surgery. For instance, if you had a herniated disc in your neck, you potentially had pain or numbness or weakness going down into your arms, and the doctor wanted to do surgery to do maybe a fusion or to pull out the disc or to do something else. So you had this underlying condition. So in order to be successful in a medical malpractice claim for orthopedic or a neurosurgical neck or back surgery, you're going to have to show that you just didn't have a bad result, but that the doctor deviated from the applicable standard of care. Let me give you a few for instance. You're going in for neck surgery, and the doctor, when they are removing the disc before the fusion, goes ahead and hits the spinal cord and causes a spinal cord injury. Arguably, that is a deviation from the standard of care or malpractice, and if you have residual effects from the spinal cord injury, then you could bring a claim for medical malpractice. On the other hand, if you go in for low back surgery and you have the disc removed and you end up getting something called arachnoiditis, which is an inflammation in part of a covering of the spinal cord called the arachnoid layer, or it's in a meninge, that is a normal risk and complication of the procedure, and barring anything else that happened, you potentially do not have a medical malpractice claim. Likewise, if you go in for surgery and you get a little bit of a dural tear, which causes fluid from the dura to go ahead and leak, and the doctor notices it and repairs it, then you most likely do not have a medical malpractice claim. On the other hand, if you go in for a low back surgery and the doctor cuts the nerve root, then you potentially have a medical malpractice claim. So with orthopedic and spinal injuries, neck and back injuries, you have to try to understand that you already had a problem, that you had an underlying problem that required the surgery, and there has to be a deviation from the standard of care that made your condition worse. If you have any questions regarding orthopedic or neurosurgical malpractice related to neck or back surgery, you can always reach out to me. I am Guy DiMartino, meeting you at the intersection of law and medicine. Have a great day.